Good afternoon, everyone. I'm Eric Nestler, Dean for Academic Affairs and Chief Scientific Officer at the Icahn School of Medicine at Mount Sinai, along with Dr. Marta Filizzola, Dean of the Graduate School of Biomedical Sciences. It is our great pleasure to welcome today's graduates, their families, and friends to this 8th Master's Commencement. Our graduates today represent diverse fields of inquiry spanning public health, epidemiology, healthcare administration and delivery, biomedical and clinical research, biostatistics, data science, and genetic counseling. Some of you will be continuing your graduate education, but most are heading to jobs in the healthcare sector where your work will have real-world impact immediately. We are very proud of your impressive accomplishments, which have already been felt locally and globally. As we fight to get to the other side of the COVID-19 pandemic with which we've all dealt over the last several years, the virus itself is now endemic and joins many other routine viruses like flu or RSV with which humanity has grappled for decades. At the same time, however, our society is facing an accelerated uptick in the emotional consequences of the social deprivation, economic inflation, and other challenges the pandemic brought. With these factors compounding conditions that preceded the pandemic, such as increased global competition, harmful consequences of seemingly many of our obsession with social media, and the troubling political divisiveness that we see both in this country and around the world, it is not surprising that we are facing a second pandemic, this one involving stress-related illnesses, among which are depression, post-traumatic stress disorder, anxiety, and drug addiction. I'll just share a few statistics because there's been a lot of attention given to this in the general media. Before the pandemic, it was estimated that 1 in 6 people suffer in their lifetime from depression, PTSD, or anxiety. Since the pandemic, that number has doubled, 1 in 3 individuals. Studies show that 1 in 2 among college-aged women, a staggering statistic. Analysis of millions of hospital admissions in the U.S. has found that suicidal behavior has more than doubled for children under the age of 16 over the past 5 years. Addiction, which my lab studies, has cost the lives of 70,000 Americans from drug overdoses before the pandemic. That number has increased to 100,000 lost lives each year, with many-fold more lives damaged by drug use. And closer to home, studies at several major medical centers report that close to half of our frontline workers, doctors, nurses, support staff, exhibit burnout, and increasing studies show that similar levels of burnout are also seen in the research enterprise among graduate students, postdocs, faculty, and staff. This is a national call to arms with devastating effects on individuals and their families and enormous lost productivity in the workplace, but somehow we as a society tolerate this ever-increasing toll year after year. We have simply lacked the will to take substantive steps. Despite the passage of cosmetic laws, we are not even close to achieving parity in mental health care, and that's the reality in blue states as well as red, including right here in New York City. We need ready access to quality mental health care. This is priority number 1. I say this as a psychiatrist. It's a personal thing for me. I'm very pleased and proud to say that Mount Sinai is taking this challenge to heart. You may have heard that just a couple of weeks ago we opened a new behavioral health facility in Lower Manhattan, $140 million investment in a 130,000 square foot new mental health facility. This is the largest expansion of private mental health services we think ever before in the state of New York, and we hope that other institutions will demonstrate a similar level of commitment. We need new federal policies to encourage our youth's judicious use of social media, policies to promote responsible and healthy use of technology. I don't know if you've heard the term digital well-being. We need to dramatically dial back the level of stress that we place on our children, teens, and young adults. I've told my students over the years that your generation is facing far more stress than my generation ever faced. This will require major changes in schools, youth sports, and more. We have lost sight years ago of a warning from Aristotle, who stated in 350 BC, educating the mind without educating the heart is no education at all. We need to dramatically strengthen our sense of community that has become severely fragmented over the last 2 decades. We need to overcome stigma that still haunts people who should be seeking care. We have made significant strides in reducing stigma compared to when I was your age, but we have much more work to do. We need to master the skills of resilience to help everyone overcome disappointments and setbacks that are part of normal life. You all know Mr. Rogers, Fred Rogers, once said, "There is no normal life that is free of pain. It's the very wrestling with our problems that can be the impetus for our growth." And we need more research funding. NIH funding for mental illness has been roughly 1/10 that of cancer over the last half-century. We are now in a renaissance period of neuroscience and genetics research, and I remain more optimistic than ever that these technological advances will dramatically improve our understanding of the brain and make it possible to develop cures and preventive measures, which your generation will see throughout the course of your exciting careers. Your advanced training at Mount Sinai prepares all of you to take on these and many other major challenges facing us with the boldness and creative solutions they require. I am confident that you and your generation will make a difference and leave our local, national, and global communities a far better place than we find them today. I wish you well on your new adventures, and please remember that wherever your careers take you, you will always be part of the Mount Sinai family. Thank you.